Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm Paul White. We're glad you joined us. Before we begin, I'd like to thank our sponsors, Altman Health System, Studio Arts and Glass, and Genuine Appraisals and Liquidations. Today, Brad and I are broadcasting from our administrative offices, and our guest is Jim Adams, Health Commissioner for Canton City Public Health. Good morning, Jim, and welcome back to the show.
Good morning, Paul. Good morning, Brad.
If you've been watching or listening to the news lately, concerns of a tripledemic have been frequent headlines. There's no scientific definition for this term. It simply refers to the collision of RSV, influenza, and COVID-19 to the extent that it might overwhelm hospital emergency departments. Listening to customers visiting our pharmacies, there's clearly a high level of illness in all varieties of our communities. This morning, we're going to talk with Jim Adams about the current illness levels in our communities, vaccines, preventative measures, and in general, staying healthy. We'd like to remind our listeners that today's program is also available on our podcast, which can be downloaded from the App Store on your mobile phone. Just look for Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anytime.
Okay, Jim, welcome back to the show. Please tell us a little bit about yourself and introduce yourself to our listeners again. Okay.
Sure. So I'm the Health Commissioner of Canton City Public Health. Canton City Health Department is one of the 4 health departments located in Stark County, the others being Alliance City Health Department, Massillon City Health Department, and then the remainder of the county is served by Stark County General Combined Health Districts. I've been with the department for almost 40 years, if you can believe that, and been the Health Commissioner since 2008.
Smokes. So let's start with
right.
I'm thinking, wow, you've seen a lot of changes. I can't even imagine.
Yes, we have.
Okay. All right, so let's start with where we are with COVID today. Can you tell us how the community is currently faring and anything new with respect to COVID?
Yeah, so as Brad mentioned at the top of the show, COVID is one of the 3 legs of the respiratory trifecta that we've experienced over the holidays and will experience for the rest of this winter. The other 2 legs being, of course, flu and then RSV. And all 3 have combined to really be a real challenge to our medical community. Our hospitals have an increase in the number of people hospitalized for respiratory illnesses. The number of percent of ICU beds, for example, have increased with people with severe respiratory illness. And so it is at levels that were equal to the big surge in 2022 as far as hospitalization. So it is quite significant. COVID, unfortunately, is still hanging on. We're in the beginning, the 4th year, if you can imagine that, of the COVID pandemic. We have seen an increase in cases, a steady increase in cases since the holiday or Thanksgiving. It is showing some signs of possibly leveling just a little bit, but really the folks that do the predictions are predicting that we still are going to see an increase in cases through the rest of the winter.
Wow. So have the symptoms for COVID changed, and what symptoms might lead you to consider you have COVID?
Yeah, the symptoms have not really changed. One thing that I think we've noticed is one of the early symptoms of the first COVID infections were this sudden loss of taste and smell. That is still a symptom for some people, but for the most part, the symptoms have become milder. They mimic most other respiratory illnesses: fever, chills, cough, tiredness or malaise. Sometimes nausea, sometimes vomiting, sometimes diarrhea, but they really closely mimic other common respiratory illnesses.
So where can listeners get free COVID tests if needed?
Yeah, it's important to get tested for COVID if you think you have a respiratory illness. The way you manage the illness is different than flu or different from RSV or different from the common cold. So, thankfully we do have readily available home test kits so that you can rule out COVID and be able to manage your disease appropriately. The Stark County Library continues to distribute free COVID test kits. Local health departments have some available. Our websites will tell you how to access those. In some cases, schools have made free test kits available to families of students in the schools. And then, of course, there are a number of test kits that are widely available in pharmacies. Many of those are you're able to get those as reimbursement with your insurance, so there'd be no cost to the individual. You can also get COVID test kits still sent to you by mail from the federal government. COVID.gov has a sign up page, and you can get some delivered to you from the U.S. Postal Service.
And we
So,
have them available at the medicine center too. So if you're interested in flu or COVID testing, we can help you out. I'll put a link in the chat on our Facebook page where you can schedule an appointment to stop in.
okay, so most of our listeners have received their first COVID vaccine, hopefully, and are now considering a booster. Who do you recommend receive boosters?
Really, we recommend anybody over the age of 5 to be fully vaccinated, which includes the primary series of vaccine and any recommended boosters. And for most people, that is going to be 2 shots of one of the mRNA vaccines and at least 1 booster shot of the bivalent booster vaccine. And there are limited contraindications for booster shots, very few of those, but we know that the COVID vaccine is widely safe. It is effective at preventing serious illness, and people should be fully vaccinated and up to date on their vaccines as part of their wellness plan.
So, what are the recommendations for listeners who recently had COVID and are considering a booster? Can they get it right away?
Yeah, CDC and the package inserts are recommending waiting at least 3 months or 90 days post-infection before receiving a booster.
Yeah.
All right, well, let's switch gears to influenza. I know we've had our fair share of cases in the community. What's the current community activity like today?
Yeah, we had a bit of a surge of flu right around January, a much earlier start of our flu season, a very dramatic number of new cases at the beginning of the flu season. We have thankfully seen some waning of that new cases. So looks like the curve is going down a little bit right now. Predictions are, though, if it follows the pattern of other flu seasons, is we will see a midwinter surge with cases continuing on through into April and May. So if you have not gotten your flu shot yet, there is still plenty of time to get a flu shot, and it's highly, highly recommended to have a flu shot. Again, flu vaccine is effective at preventing serious illness and hospitalization.
Yeah, and we can help you today at the Medicine Center with a flu vaccine too. All our pharmacies have both the high dose and quadrivalent vaccine, and you can walk in. You don't even need to make an appointment. So we'd be happy to help you with that. You know, my next question for you is really how are symptoms different between influenza and COVID? But maybe before you answer that, every year I think it's important we highlight what really the difference is for influenza symptoms versus like the stomach flu symptoms. Can you talk about that?
Yeah, in general, flu symptoms are much more severe, much more sudden onset. One of the hallmarks of flu is a sudden onset of tiredness and weakness, along with pretty severe aches and pains. The common cold generally does not have that. It's not usually associated with fever, and the onset time is slower and much more gradual.
All right. So how is that different from COVID? I know that there's some similarities, but there's also some differences.
Not much. I mean, the symptom, it's very subtle between the two. There's really no symptoms that allow you to differentiate COVID from flu just based upon symptom presentation. It really requires a test to kind of determine that. Flu, like I said, usually comes on much more suddenly, 1 to 2 days, after exposure. Usually a much more sudden onset, more severe symptoms, initial symptoms. COVID's a little slower to come on. I think most people that talk about COVID symptoms, in my own experience, when I had COVID, I just felt off for a day or two, and then decided I think maybe I should probably test for COVID, and it was positive. So I didn't have any, at least initially, any significant symptoms. So, and I think that's the experience for a lot of people. So, but there's really no big differentiating hallmark symptoms where you can definitely say one is COVID and one is flu.
Okay. So in light of the pandemic, I believe that when you have a high fever and a cough, our first thought is COVID. If somebody takes a COVID test and it's negative, Should they assume it's influenza, or what do you recommend their next steps should be to take into consideration?
Yeah, that's a good question. I mean, if you have an onset of symptoms that are similar to COVID or flu, you should definitely consider either of those. And you should contact your medical professional as soon as possible. In both cases, both flu and COVID, there are treatments that are available that, if given within the first few days of infection, can really lessen the severity of the illness, shorten the length of the illness, and definitely prevent hospitalization. Lessen that risk of hospitalization because of severe illness. So it's very important not to ignore these symptoms, but to contact your medical provider and follow their advice very closely early on.
Interesting.
So, Jim, we have influenza vaccine available in our pharmacies for any of our listeners still looking for the shot. But overall, are you seeing a decrease in flu vaccination rates, which might be fueling a higher infection rate this flu season?
Yeah, that's a good question. And there's kind of two answers to that. One is, yes, there is a slight decrease in the estimated number of people covered by flu vaccine right now. Generally, it's over 40%. Right now, CDC is estimating less than 43% are vaccinated for the flu. So that's a lower than predicted vaccination rate. So that is certainly a problem. The other issue is, I think, throughout the early part of the pandemic, we had shutdowns. We avoided social gatherings when we were sick. We definitely wore a face covering when we were around other people or had active illness. And that, I think, clearly played a part in helping slow the spread of the viruses that cause these illnesses. And so I think, in my own opinion, one of the drivers of this sudden spike is the fact that we weren't covering our cough and wearing a face mask when we were ill.
Interesting. Time for our first break, Jim. You are listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. Friends, it's not too late to get your flu shot. Stop in any Medicine Center Pharmacy today. No appointment necessary. We look forward to helping you stay healthy.
Jim, I've been thinking, over the past couple of years, as we've been learning more about the spread of viruses, that, early in my career, we had to be tough and we went to work, whether we were sick or half dead or whatever. And, you probably spread stuff all around and infected other people. It seems like now we're a little more aware of washing hands and wiping down frequently touched surfaces. But what can you tell the public to recommend for when you have a bug of some type? What's the best practice for preventing further spread?
Yeah, well, the most important thing, as you mentioned, is to really stay home when you're sick. And if you have the beginnings of a respiratory illness, you should stay home and try to figure out what's going on. We strongly encourage employers to have liberal sick leave policies that would allow somebody to stay home until they can figure out what is really going on with their illness. It's going to not only help that individual, but it's going to help the business's ability to stay open. If you have a lot of people off at the same time with a serious illness, obviously it's going to cause more problem than just one or two. But it's real important to stay home for those first few days. It's important to kind of differentiate if you have COVID or some other respiratory illness, because you're going to manage that staying home portion differently because of that. You should test within 3 or 4 days after your symptoms first appear. If you have symptoms, test again on day 5, just to make sure that if the COVID test is negative, test again on day 5, just to make sure it's still negative. But we're still in that area where we have to be very, very careful. If you still have an active cough, it is perfectly fine to wear a face covering to help control the cough. That's the main way that these respiratory viruses are spread. So if you wear a face mask while you are coughing or ill, it's called source control. You're going to help prevent the spread to other people and the surfaces. Wash your hands. You mentioned washing hands. Washing hands is extremely effective at preventing the spread of viral respiratory illnesses.
Interesting. So the third part of the triple epidemic is RSV. What is RSV? And it is circulating in our community, I guess. Yeah,
RSV is a virus that's been around since around 1956 when it was first identified. I had to look this up. I didn't know this off the top of my head.
Okay.
But it's called respiratory syncytial virus. I always have to kind of stop and pronounce that properly, but it is a virus. It's very, very common, very infectious, affecting mostly young people. This current surge that we experienced right around Thanksgiving was huge, and it affected children that were between 4 years of age and less. And thankfully, that surge is past us now, and we've gotten down to more normal levels of RSV. But through Thanksgiving and the early part of December, it really challenged hospitals that had to have people that were hospitalized because of some of these severe respiratory symptoms. So it can be serious. It usually is mild, but it can be serious. A couple of the symptoms that you see in RSV that you don't see in some of the other respiratory illnesses are wheezing and shortness of breath. Now, you do shortness of breath also with COVID. In fact, it's very common to have shortness of breath with COVID, but wheezing and difficulty breathing can be with RSV, and that can be pretty serious for young kids and necessitate a call to the pediatrician or your doctor.
Jeez.
Mm-hmm. But yeah, it's the third part of the trifecta. So we had all three going on at the same time. So it really presented a challenge for families. It presented a challenge for the medical community, a challenge for our hospitals.
Okay, so I guess when should you seek out a doctor or a pediatrician with this thing for your kids? I mean, you got all three of these. You got to call a couple of these things together. That's kind of ugly. It
is. Certainly any sudden change in symptoms, a high fever, wheezing, shortness of breath would all necessitate an immediate call to the doctor to find out what your next steps would be.
Gosh.
It does not necessarily, I mean, I would not discourage people to use the emergency room, but I would definitely call your medical provider before seeking care in an emergency room. In many cases, they're able to work things out without having to wait for hours and hours in an emergency room.
Yeah, sure.
Yeah, wait times in our emergency rooms are extremely high.
Wow. All the schools are back in session. Is that right, from Christmas break? And with so much illness circulating, what recommendations do you have to keep your children healthy?
Yeah, so the first thing I would say is to make sure your child is up to date on its vaccinations. So there is a recommended vaccination schedule for children. It is designed to prevent many, many serious vaccine preventable illnesses. So you want to make sure your kids are up to date on their vaccines, and that includes flu and COVID. The second is if your child is sick, has a fever, they need to stay home. If you're sending your kid to school with a lot of Tylenol in them to mask a fever, you're increasing the risk of spread of respiratory illnesses to other kids in that classroom. I know that it's a significant challenge for most families because childcare is such an issue. You know, parents have to go to work, and school is a very important part of that, you know, for keeping your child safe during the day when you're having to work. But it really presents a challenge for the rest of the classroom if you're sending your child to school with a fever or other respiratory illness.
Interesting.
Yeah, my wife works at an elementary school, and she said that sickness has been rampant, and it's been interesting. And maybe, I don't know if it's worth you commenting on, but you know, I know that we're all busy and we're trying to, you know, get to work and pay the bills, but it seems like the illnesses we're having lately kind of linger. So, you know, they take 3 or 4 days to kind of get over, and then if you're not careful, they come back. So are you seeing anything like that in the community? Because I guess we're used to having a cold and getting over it, and maybe your cough lingers for a week, but it's not like you're down for 3 or 4 days and then all of a sudden you're thinking you're good, and then boom, you're down another 3 or 4 days.
That's right. Yeah, I know from our own personal experience that's happened in our family. Got a respiratory illness and then a sore throat and a cough that lingered on for like a month, and it was tough. My wife also works in healthcare. She's a school nurse at one of the local elementary schools, and so sees a lot of these situations firsthand. And you know, that's why I comment about the struggle that a family has in trying to decide to send a child to school or stay home because of this need to be able to, you know, the requirement to have to work. You know, your employer may not have a very, you know, liberal sick leave policy, or you may be out of sick leave, or you don't have any at all. And it's it's a really heartbreaking decision that families have to make. And I know they don't make it lightly.
Wow.
I read not too long ago we had some measles in Ohio. Are we having a resurgence, or is that something that was just an isolated case?
Well, it affected 3 counties in central Ohio. There was a measles outbreak just before Thanksgiving and through the Thanksgiving holiday. It was in, like I mentioned, central Ohio, all young children. Every case of measles was in a child that was unvaccinated. And so the disheartening story about that is measles is a very vaccine preventable illness. Vaccine is about over 90% effective at preventing actual illness for measles. And so we know that vaccination is very, very important for measles. It can cause severe illness. It can spread very, very quickly, like this outbreak did. Thankfully, the local health authorities in those 3 counties were able to really track these cases and watch them closely, and to help prevent further spread. We had one person we were watching in our community that was exposed to that outbreak, and thankfully they did not develop measles. Those kinds of things can happen. And the main reason is a low vaccination rate in the community. Once it falls below that threshold, whereby you don't have enough immunity in the community, then you have these outbreaks that pop up.
Interesting. I suppose we're very close to the next break, so I think we'll take it. Yeah. It is the bottom of the hour. Time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center. I'm your hosted pharmacist, Paul White. This morning, Brad and I are talking with Jim Adams, Health Commissioner for Canton City Public Health. We have a lot more to cover this morning, so let's get back to the show.
After COVID, Jim, the term vaccine weary surfaced. Are Americans tired of vaccines and falling behind on the vaccine immunization schedules for themselves and their children?
That's a good question too. I think, all of us are really tired about talking about vaccination. I know that the challenge from, certain sectors that are talking about vaccines are causing more illness than they're curing. They are hurting people, they're harming people. Social media, with statements that are generally not accurate about vaccine. It just wears us out and trying to figure out what is really true and what's really not. And so, if we have a level of doubt, most of us are going to hesitate a little bit and say, well, maybe they're right. Maybe I need to think about this a little bit more. So, yeah, I think it does cause people to think a little more carefully about it. There has been, as we know, for many years now, a growing effort to discredit childhood vaccinations and try to modify that childhood vaccination schedule, or even eliminate childhood vaccinations as an option for prevention of serious illness in children. And so, that has been there since before COVID. That COVID really, I think, highlighted the fact that brought this issue about vaccination to light. And it was nothing short of a miracle to develop COVID vaccine the way that it was developed. And we, within about a year, transformed COVID from a pandemic with no significant medical intervention available to us to really a vaccine preventable illness like flu. And that is really a medical miracle. And but many people still consider that as not really not a good thing. And it for somebody that's been in the business for this long, I'm sure you guys feel the same way, that it's very discouraging to hear that.
Wow.
Yeah, I don't know. I guess I just encourage people to, if ask questions of healthcare providers. Don't assume what your neighbor tells you or what you read on Twitter is true. I guess the level of misinformation has never been higher, in my opinion. And I guess, I know it's a free country and you can do whatever you want, but I just feel like make sure you've got the right information before you make a decision. Don't be emotionally influenced is I guess what I'm thinking.
Yeah, that's a really excellent point, Brad. And, early in the pandemic, public health had to make some really tough decisions that were extremely unpopular, and in order to protect the general health and welfare of the community. And those were not easy decisions to make for anybody. And, you know, our own personal approach is that people should make their own choices about their health care. And we want people to really look at that in a logical fashion, in a well-informed decision that is made. Don't want to really come to the point where somebody, public health, is mandating vaccinations, mandating this, mandating that. I don't think that works for anybody. But we do want people to get good information and get it from a reliable source. Your pharmacist, obviously, is an extremely reliable source for questions about healthcare, for medication, for vaccines. Your medical provider, a doctor, advanced practice nurse, somebody like that is a very good source of information. Probably the worst source of information is social media. And so I would be very, very suspect of anything that I read online if I could not trace it back to a reliable source.
I was thinking about some comments I read the other day and how valuable it would be if you were required to cite sources on everything you did. So, you know, I guess it takes me back to school when it's one thing to read it in a book, but you could always follow where the path came from and the studies and the research and whatever. So, but you know, that being said, I think it's frustrating to me when you talk about measles or even polio that's coming back in the environment. I mean, it seems like we had such great control of those things, and now all of a sudden we're backpedaling. So
yeah, polio, it's a very interesting story. You know, we had a gentleman in county in New York that had polio that we thought was we don't know where he got it. They did some extensive studies, did not find any additional cases, as I recall, but they did do a lot of studies with wastewater. And so you look in the wastewater and you can find pieces of the polio virus in wastewater and try to characterize it that way. And they were seeing increases in polio particles identified in wastewater, but no additional cases yet. So that means that somebody has polio and somebody is shedding polio, and we just don't know about it. And so that really, really highlights the real reason we have vaccines and the real reason that we need to be vaccinated if we can get vaccinated, because those illnesses are out there. And if we let our guard down, they're coming right back, and they're coming back with a vengeance.
Were the three counties in Ohio that got the measles together, were they parallel to each other or
yes,
not?
They were. Yeah, they were geographically close to each other.
Where are they? Where were they?
One was Franklin County. That's a good, you're going to make me try to cite my Ohio geography, right? I believe it was Franklin, Licking, and I think Delaware, but I can't remember the third county. Right.
Interesting.
Yeah.
Franklin County, that's Ohio State, right?
I think it's Columbus. That's our state capital. That's Ohio State, right?
Huh. Interesting. Where are we at, Brad? Go ahead.
What comments would you have to share with our listeners regarding the safety and necessity of staying current with immunizations?
Well, as we've just stated before, you know, I'm all in on immunizations. You know, it is a medical, they are safe, they are effective. There is extensive systems in place in the US for the development and testing and approval of vaccines. Through COVID, it was very interesting that the debates from the committees that actually recommend the use of these vaccines were online. You could watch the debate happen in real time. And it was very encouraging to see these people that are responsible for this to take it very, very seriously and raise a lot of questions and concerns. And we have a very sensitive system for reporting any vaccine problems. You're familiar with that, you know, the VERA system for reporting vaccine problems. And, you know, I would just say we have a very sensitive system for identifying these things. And so to suggest that we would have, you know, 1,600 people fall over from COVID vaccine or things like that, I think is just kind of preposterous. It just doesn't track with what at least I understand and what most people understand is what the real state of the system is. So, you know, vaccines in the United States are really, really an important tool for maintaining the health of not only individuals, but our communities.
I think it's interesting, and I don't want to get in the weeds, but when you take the time to go to the VAERS website and you drill down and you look at how many millions and millions of vaccines have been given for COVID, and then you look through the side effects or the issues. I mean, you know, we all have issues, you know, you can't, I guess, you know, a person in perfect physical health versus a person who's suffering with chronic diseases, you're always going to have some situations where you never know exactly what the tripping point was. I had a cardiac